The reason it's serious is that a question that was asked by Dr. Harris is that the mortality of this is multiple times what seasonal flu is. So seasonal flu spreads widely. The mortality is 0.1%. Right now in China, the mortality for this particular infection is, the latest report was 3 to 4%. It might be a little bit less. It isn't a cold.
Tonight, you're minimizing the risk, the danger of the virus. Are you telling the Americans, except for the ones who are sick, not to change any of their behaviors?
No, I think you have to always, I do it a lot anyway, as you probably heard. Wash your hands, stay clean. You don't have to necessarily grab every handrail unless you have to. You do certain things that you do when you have the flu. I mean, view this the same as the flu.
It's essentially what I said multiple times from this podium, is that when you have, first of all, we're trying to develop de novo drugs that are not yet out there, not approved, that ultimately would be effective. And the way you prove that is to do a randomized controlled trial to prove safety and efficacy. I'm not totally sure what the president was referring to, but I believe he's referring to a report that used both hydroxychloroquine and azithromycin together to have some possibility of being in effect. Many of the things that you hear out there are what I had called anecdotal reports. They may be true, but they're anecdotal. So the only thing that I was saying is that if you really want to definitively know if something works, that you've got to do the kind of trial that you get the good information. The president is talking about hope for people, and it's not an unreasonable thing to hope for people. So when you have approved drugs that physicians have the option in a decision between the physician and the patient, are you going to use a drug that someone says from an anecdotal standpoint, not completely proven, but might have some effect? There are those who lean to the point of giving hope and saying, give that person the option of having access to that drug. And then you have the other group, which is my job as a scientist, to say my job is to ultimately prove, without a doubt, that a drug is not only safe, but that it actually works. Those two things are really not incompatible when you think about that, particularly when you're in an arena where you don't have anything that's proven.
The other thing that we bought a tremendous amount of is the hydroxychloroquine, which I think, as you know, it's a great malaria drug. It's worked unbelievably. It's a powerful drug on malaria. And there are signs that it works on this, some very strong signs.
Yeah, I mean,
I've seen things that I sort of like. So what do I know? I'm not a doctor. But I have common sense.
The doctors who are treating coronavirus patients, they have the medical expertise to determine whether or not they should prescribe hydroxychloroquine.
And many of them
And
do.
there are already clinical trials in place looking at hydroxychloroquine.
Sure.
So
They should be finished in about a year.
Why not just let the science speak for itself? Why are you promoting this drug?
I'm not. I'm just saying, very simply, I'm not at all. I'm not. Look, you know what I'm trying to do? I'm trying to save lives.
You come out here every day, right, sir, talking about the benefits of hydroxychloroquine.
I want them to try it, and it may work and it may not work. But if it doesn't work, it's nothing lost by doing it, nothing. Because we know long-term what I want to save lives. It may not work, in which case, hey, it didn't work. And it may work, in which case it's going to save a lot of lives. Now, a lot of people say if the people walking in prior to getting it, if they take it, it has a profound effect. Well, maybe it does, and maybe it doesn't. I don't want to wait a year and a half to find out. And only CNN would ask that question. Fake news. Go ahead.
Sir, I have one for you on oil.
I predicted that we would be about 2 to 3 months to go into phase 1 trials. And I think we're going to beat that. I think we'll be in probably about 6 weeks, which, as a matter of fact, will be the fastest that anyone ever has gone from the identification of a sequence into a phase 1 trial of any vaccine that's ever been done. That's the good news. The sobering news is that since vaccines are given to normal individuals, what is paramount is safety and whether or not it works. So we'll do a phase 1 trial. We'll do it in a number of our centers, including our center at the NIH. That will take about 3 to 4 months. And then if successful, which I believe it will be, there's no reason to believe it won't be safe, we'll go into what's called a phase 2 trial. The phase 1 trial is 45 individuals. Phase 2 trials are hundreds, if not a couple of thousand individuals. It would take then about a year to a year and a half to be fully confident that we would have a vaccine that will be able to protect the American people. And so although the good news is we did it fast, the bad news is that the reality of vaccinology means this is not going to be something we're going to have tomorrow.
What do you want to hear from pharmaceutical executives about the vaccine? Well, we're talking, this meeting was set up before, and that was about drug pricing. This meeting was set up a long time ago with the pharmaceutical companies, and that meeting was about drug pricing because we brought the numbers down last year. First time in 51 years that the drug prices prescription have come down. And I have a meeting scheduled on drug prices, but now we're going to make another subject, and that'll be probably the first subject, and that has to do with the vaccine. How are they doing? Is it possible to accelerate the development of a vaccine? Well, that's what we're going to find out. We'll know that. Well, we've asked them to accelerate whatever they're doing in terms of a vaccine. Absolutely.
And importantly, I think what people don't fully appreciate is that putting a mask on yourself is more to prevent you from infecting someone else. And if everybody does that, we're each protecting each other because the data is it's more efficient to prevent transmitting to others than it is to prevent transmission to yourself. But you can completely cover that ballpark if essentially universally when people go out and are in a situation where they might come into closer contact, that they wear that mask. So we discussed this in detail yesterday, and in today's task force meeting, it will also be discussed in detail. So there may be recommendations coming out. They likely will be.
What would people gain from wearing a mask, and why are you opposed to wearing one yourself?
Well, I just don't want to wear one myself. It's a recommendation. They recommend it. I'm feeling good. I just don't want to be doing, I don't know, somehow sitting in the Oval Office behind that beautiful Resolute desk, the great Resolute desk. I think wearing a face mask as I greet presidents, prime ministers, dictators, kings, queens, I don't know, somehow I don't see it for myself. I just maybe I'll change my mind, but this will pass, and hopefully it'll pass very quickly. Now, with that being said, if somebody wants to, I mean, most people can just make something out of a certain material. So it's very well designated. It's very simple to do. I won't be doing it personally. It's a recommendation.
Can you explain why the U.S. looks like it's on the same path as Italy right now?
Yeah. It's just the reality, Savannah. I mean, it's the truth. If you look at the curves of the acceleration of cases, hospitalizations, and deaths, you know, it's superimposed, corrected for population. It's a really serious issue. I mean, Italy got hit very hard, and it's very clear that we are getting hit very hard. Right now, the epicenter of it in the United States is New York City, but as you see, it's not going to be confined to New York City. We're going to be seeing this kind of thing in other large cities. It's a very difficult situation, as was predicted. This is going to get worse before it gets better, for sure.
You don't have to buy so much. Take it easy. Just relax. People are going in, and they're buying more. I remember, I guess during the conversation, Doug of Walmart said that they're buying more than they buy at Christmas. Relax. We're doing great. It all will pass. The folks that we spoke to, they've done a fantastic job. They're going to meet the needs of the public. They're going round the clock if they have to, and they're committed to the communities where they're serving and which they serve so beautifully and have for a long time. And they're buying a lot of additional things to sell. But again, they actually have asked me to say, could you buy a little bit less, please? I thought I'd never hear that from a retailer.
It would certainly be nice. Dr. Anthony Fauci is a member of the White House Coronavirus Task Force, and he's also the top infectious disease doctor at the National Institutes of Health. Dr. Fauci, good morning. So we just heard that these models showing death projections in the United States have fortunately been revised downward, but that's only one model. What are you seeing among all the models, and what does it mean for this reopening potentially of the country?
Well, you know, the models, as I've often said, are as good as the assumptions that you put into the models. And those assumptions, sometimes when you tweak them a little, they really change the range of the kinds of projections that you've heard. Remember, we were talking about 100,000 to 200,000 deaths. What's happening is that we are doing a very good job on mitigation, on the physical separation, the adherence to the guidelines. And as new data comes in, what you do, you integrate that data into the model to modify the model. And that's why you're seeing those projections coming down somewhat. That's good news, but the thing we have to be careful of that we don't then take that good news to think that we might be able to pull back a bit. We've got to continue, in many respects, to redouble our efforts at the mitigation of physical separation in order to keep those numbers down and hopefully even get them lower than what you've heard recently.
For Christians all over America, this is Holy Week. We remember the resurrection of Jesus Christ. So important. But this Easter will be much different than others because in many cases we'll be separated physically only from our churches. We won't be sitting there next to each other, which we'd like to be, and soon we'll be again. But right now we're keeping separation. We're getting rid of the plague. It's a plague on our country like nobody's ever seen. But we're winning the battle, we're winning the war. We'll be back together in churches right next to each other. Celebrate, bring the family together like no other. We have a lot to be thankful for. Happy Easter, everybody.
South Korea and the U.S. announced their first confirmed coronavirus cases at virtually the same time in late January. If you take a look at where we are right now in the U.S. now has 50 times more cases and almost 100 times more fatalities than South Korea. Meanwhile, while the U.S. makes up only about 4.25% of the world's population, the U.S. has 30% of the world's reported coronavirus cases and almost 20% of the reported coronavirus deaths. Sanjay Gupta said this is all because we got started too late in the U.S. Is that right? Do you agree?
You know, it isn't as simple as that, Jake. I'm sorry. I mean, to just say this is all happening because we got started too late. Obviously, if you look, could you have done something a little bit earlier? Would it have had an impact? Obviously. But where we are right now is the result of a number of factors. The size of the country, the heterogeneity of the country. I think it's a little bit unfair to compare us to South Korea, where they had an outbreak in Daegu and they had the capability of immediately, essentially, shutting it off completely in a way that we may not have been able to do in this country. So obviously, it would have been nice if we had a better head start, but I don't think you could say that we are where we are right now because of one factor. It's very complicated, Jake.
When you say the Americans were scared, though, I guess nearly 200 dead, 14,000 who are sick, millions, as you witnessed, who are scared right now. What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. Go ahead.
I
think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. The American people are looking for answers, and they're looking for hope. And you're doing sensationalism. And the same with NBC and Comcast. I don't call it Comcast. I call it Comcast. Let me just for whom you work. Let me just tell you something. That's really bad reporting. And you ought to get back to reporting instead of sensationalism. Let's see if it works. It might and it might not. I happen to feel good about it, but who knows? I've been right a lot. Let's see what happens, John.